Okay, let's start. Today is the last topic about no. Don't be that happy too fast. Today is the last topic about intestinal infections. The year didn't finish yet. Okay. So today we're gonna discuss about cholera. And I guess it makes sense for you to pay a little bit more attention to this topic for a simple reason, as well as I know, please correct me if I'm wrong. In your home country, there are enough regions in which this infection is endemic, right? Yes. So there is a chance you will have a deal with this issue. First of all, there is something in common between cholera and other intestinal infections. And what is in common? It produces quite similar disorders as previous infections we discussed. But there are some very serious differences that can make it very easy to diagnose specifically this infection. If we are talking about its morphology, cholera is caused by a genus that is called Vibrio cholera, and it can include several serovariants that are mostly pathogenic for humans. They are comma shape, so it is something in between rod shape and spiral shape. It is comma shaped bacteria. It is motile due to exoflagella that is situated, as well as you can see on this picture, it is situated on the one side of bacteria. It is gram-negative, and you can observe it makes part of those exceptions, right? Just as we discussed, that every genus that finishes with A is gram-negative. But here, the name of genus is Vibrio, but it is gram-negative. How we keep it in mind? It makes part of intestinal infections. And as well as we know, most of intestinal infections are caused by gram-negative bacteria. So this is how it will look under the microscope. Something in between rod-shaped and comma-shaped bacteria with flagellum on the one side, monotrichus we call it, yes? And gram-negative. The mostly important part of this infection is its nosology and clinical manifestation. Clinical manifestation of cholera is very specific, and its clinical manifestation will be due to the infectious process, due to all the processes that are happening on the level of the intestinal tract. If we compare clinical manifestation of cholera with other intestinal infections, we can observe some differences. Whenever we are taking the classical infectious process during salmonellosis, escherichiosis, shigellosis, what happens? The pathogen is entering the intestinal tract. It will attach to the mucous membrane of the intestinal tract. It will produce inflammatory process. Due to this inflammatory process, we will have inflammation. Those five signs of inflammatory process: rubor, tumor, color, dolor, funcție lesă. That means inflammation, increasing in volume. Redness, you will not observe it, but it is. You can just believe me. Local increase of temperature, also you will not feel it. You can just believe me. Pain, you will feel it, and dysfunction. What means dysfunction? Which is the function of the mucous membrane of the intestinal tract? Absorption. It is main function of the intestinal tract. Absorption of liquids and absorption of nutrients. So when we have an inflammatory process of the intestinal tract, what happens? Disorder of the mucous membrane in the intestinal tract. Right? As a result, we have irritation and we have malabsorption. As a result of irritation, motility of the intestine will increase, and evacuation of the contents of the intestinal tract will be faster. Absorption is decreased and motility is increased. This is why in any classical intestinal infection we have diarrhea, liquid stools, because of decreased absorption of liquids and increased motility of the entire intestinal tract. Not the same thing happens in cholera. In cholera, it happens differently. It doesn't produce that classical inflammatory process for the intestinal tract as in other infections. The Vibrio cholera that spreads by drinking water specifically, and on the second place by contaminated foods, but mostly specific by drinking water, especially when you share one bottle for the entire series or the entire class. It enters the intestinal tract. It will attach to the mucous membrane, and it will start producing a toxin that will change the function of enterocytes, of these cells that are responsible on absorption. And this toxin will change backwards the function of enterocyte. So if till now the function of enterocyte was to take water from the cavity of intestinal tract and to introduce it into the bloodstream, from this moment it opens the flux backwards. So water from all the liquids from the bloodstream will start entering into the intestinal tract. In the beginning, diarrhea caused by cholera will be similar with other intestinal infections. Why? Because the contents of the intestinal tract will be similar, will look the same. Till the moment all the digestion products will be eliminated from the intestinal tract. From that moment on, we don't have any actually feces in the intestinal tract. The infectious process didn't stop, and this toxin is continuing working in order to take more liquids from the bloodstream into intestinal tract. And from that moment, diarrhea will be composed just of liquids. And actually it will look like almost transparent whitish liquid. So these are water from the intestinal tract, electrolytes from the intestinal tract and from the bloodstream, and rests of mucus from the intestinal tract. What is dangerous about this disease? Without treatment, it is irreversible process. If in some infections your body can fight, if in some infections your body can try to kill this bacteria, can try to figure it out and to solve the issue, in case of cholera, it will be just worse and worse and worse. The person is losing as much liquids as much he or she will have in the body. And it will take all the liquids from the bloodstream, intracellular liquids, everything that is possible to absorb from any corner of the body will be absorbed, because everything in this universe is trying to go to a balance. Energy, liquids, substances, diffusion, everything tries to go to a balance. So if in this cell we have a certain amount of liquid, in the intracellular space it will be quite similar amount of liquid. If we extracted liquid from the extracellular region, from the extracellular space, from the cell it will go, part of liquid will go in the extracellular space. So it will try to make a balance. So we eliminate the pathogen, the Vibrio eliminates all the liquids from the body. Too much. If you would ever have a chance to see a person infected with cholera and after a long diarrhea, that person could look like this. This phase is also called facies hippocratica in Latin, because Hippocrates had quite similar appearance. I don't know, did he died because of cholera or not? Maybe, who knows. But this is how a sick person looks. On this picture you can observe especially fingers. You can observe too much wrinkles on fingers. So the skin loses its elasticity. If I do like this with my skin, it goes back. If you take the skin of the infected person with cholera, you take it, you remove your fingers, it stays like this. So elasticity of the skin will be decreased almost completely because of liquid loss. You can observe also how will look bad for a sick person. Can you see it? The bed for a sick person will have in the middle a hole, and under that hole will be placed a bucket or any other big vessel in order to collect all the liquids we have from that patient. And here is the rule of treatment, and here is the rule how you act with patient and with liquids the patient have lost. The first rule: during the entire treatment you never throw them out. It is very important. During the entire treatment you don't throw out the liquids patient have lost. Why? In order to make investigation, I guess you would be agree that's enough a little bit, but not to collect everything. And here we can have few buckets of liquids. So yes, we will need some samples for investigations, but not that much. Why shouldn't we throw out all the liquids? Two reasons. Again? Very good. In order to be able to appreciate how much the patient lost and to know how much we should replace. Because if you will not collect and you will not appreciate the amount of liquids the patient will lost, you will not be able to appreciate how much you need to give it back just by looking at the patient. Very good. It is the first reason. And the second reason? Contagious. Very good. So, before you will throw them out, you must decontaminate or you must disinfect those liquids, usually with introducing disinfectant substance in those liquids. After that you can throw them out, either in soil, either in wastewater systems, it doesn't matter, either in a bathroom, whatever. But it is very important to not spread and to treat correctly, because the first line treatment in cholera is liquids and electrolytes replacement, basically like in any intestinal infection. It is extremely important, first of all, to replace liquids, after that to fight with the pathogen, and after that to stop to fight with symptoms, right? So on the first place, we replace liquids. On the second place, we fight with pathogens, and on the last place, we treat symptoms. How cholera is transmitted? It is also very important to know. If we are talking about endemic areas, what means endemic area? Endemic area is the place, is geographic area for which some infections are characteristic. If we are talking generally about endemics, what means endemic? It can be about infection, it can be about an animal, it can be about a plant. It is something that is characteristic for a specific area, for a specific geographic area. For example, koala bears are endemic in Australia. Also, just as kangaroos are endemic for Australia. Penguins are endemic for where? Which one? North or south? Huh? And white bears? After that, check it out. Anyways, after, not now. Anyways, different areas are endemic for something. Same thing with infections. Some geographic areas are endemic for cholera. Some of them are endemic for malaria. For example, some African countries are endemic for malaria, or tropical countries. So when we are talking about endemic areas for cholera, usually we are talking about maybe developing countries or developing regions where we don't have centralized water supply systems, where we don't have centralized wastewater systems. All the infrastructure all the water infrastructure is missing. And the best example of that is one of the mostly famous rivers in the world, that is called, how is called that river? Huh? Hi, come on. Ganga. Don't go too far away from the problem. Ganga River. It is famous because of what? Why Ganga River is famous? Should I tell you? Who've been ever there? I didn't. Anybody could explain what's wrong or not maybe with the Ganga River? A lot of dead bodies. What else? A lot of waste. What else? And still, do people use this water as a source of drinking water? Yes. is there a chance to get cholera and any other infection? I guess if you do not die in first few months after contact with that water, you probably become immune against everything in this world. I guess so.
Like a vaccination.
Stronger than vaccination. So we shouldn't think it is the only place in the world with such situation, but specifically this one is very famous. So what should we do in order to prevent spreading of such infections? What should we do? Tradition is tradition. Maybe it's good, maybe not all the time. But infrastructure is very important. So the first thing we need to do is to create infrastructure. To create infrastructure for water supply of the population, and infrastructure for wastewater collection and decontamination, first of all. Second, that's clear that it is not that easy to create all of these infrastructures. So before we'll create all of these infrastructures, it is very important to induce that hygienic culture that is missing for some people. Hygienic culture is extremely important because there are some regions, enough regions in this world where people do not have anything, do not have centralized water supply, they don't have wastewater, they have just bottle of water in their pocket, in the desert. And can you imagine they will use this water first for hygienic needs and just next, if they will have a little bit, for drinking needs. Why? Because they understand that hygiene could be even more important than my thirst. Because if I don't keep my personal hygiene, I can lose even those liquids I already have. For example, like in cholera. If I will just drink and drink without washing, without boiling, without disinfecting, without decontamination, it is extremely important. So the next thing you are responsible on. The first one is up to government. You are not able to come to a village that doesn't have wastewater and centralized water supply with the clean drinking water. You cannot come in any village like that and to create all the infrastructure they need, right? But what you can do, you can influence the culture of population as a doctor. Because a lot of people will give you a lot of questions in the place you will work. And first of all, you will need to teach some people who doesn't have this hygienic culture. You will have to teach them how to live in order to not die. It's very important. How to decontaminate drinking water, how to decontaminate food products, how to keep personal hygiene. How often should they wash their hands? How often should they wash their clothes? Why shouldn't they use in common different personal items? If you will teach your patients in future all of these simple but extremely important things, you will decrease your work in future. It is also very important. And after that, also is extremely important vaccination. And by the way, against cholera, we have some vaccines. So it is duty of Ministry of Health to obtain vaccines for regions in need, and your duty is promotion of vaccination. Your duty is to explain to the population why vaccination is that important, how it can help you until they will have all the systems centralized, all the infrastructure in their house, when they will not need to go to a river to throw their wastes and to collect some drinking water, because everything will be in their houses. Before they will obtain such facilities, your responsibility, your duty is to teach them why hygiene and why all the precautions are that important. This is when we are talking about endemic regions. But still, in any country, in any place, potentially could appear outbreak of cholera. When it happens, for example, in natural disasters. Let's imagine we have flood here in Chisinau. Is it possible? No? Why? No rivers. There is one river, but it almost disappeared. The big river. But the flood is not just because of rivers or lakes or sea or anything like that. Flood can appear because of rains. And since the Chisinau is sitting on hills, a lot of districts in this city are situated where? In valley. And those places can get in flood after any big rain. If you will, do you know where is Piazza Centrale? So, in the center, and a little bit lower, if you will go, you can arrive to the river Big, and it is the lowest place in the city. After every big rain, after every strong rain, I don't recommend you to go there. It is extremely dangerous. So some places, or when you are going to a shopping mall, on the bridge, can you see all of those houses under the bridge? What happens after a big rain? Or when you're going with Rutiera from the central building to the Malina Mica, and there is rain, and you're going on that street, what happens there? In a simple rain, not too strong rain. Rivers, you cannot walk there, right? But what happens if the rain will be stronger? A lot of houses can get in flood. So those who are situated on the top of the hill, of course, they are safe. But those who are situated lower, they're in danger. This is how flood can appear, even in a city without rivers. Or some other natural disasters like earthquake. Can it happen here? Can it happen here in Chisinau? Earthquake. Yes or no? I've been witness of few. Not too strong, but in Romania we have some epicenters of earthquake that sometimes can be reactivated. And there is a chance we'll have here earthquake. What happens? It can bother the pipes of wastewaters and pipes of water supply, the supply for of the population. What happens? Of course, according to the rules, pipes with drinking water are situated closer to the surface, and pipes of wastewaters are situated lower. If something will break, the clean water will flow down, not and the chance that the wastewater will get in the drinking water will be lower. But still, if it will be too much, you will have a mixture of wastewater and drinking water. And when you open your pipes in your houses, you are drinking contaminated water. Meanwhile, in our the water we have is considered drinking water. You can drink it, and I assure you, I know people who are making daily investigation of that water. It is absolutely safe for drinking. Moreover, it is much more safe than bottled water. Some people are buying in order to be more healthy. So think about it. But if some natural or non-natural disaster will happen, in any place can appear an outbreak of some intestinal infections, including cholera. So, did you observe when you have breaking news about some disasters in some regions, especially flood, which is the first thing they bring in the epicenter of the disaster?
Yeah.
What do they bring?
Camps.
Camps? In water? If we have flood, where do you put the camp? What do they bring? Drinking water. The first, did you observe, especially in case we have a region with flood, first of all, evacuation of the mostly vulnerable population, and those who can stay there, they provide them with drinking bottled water, because it is the first product they are missing. As much water you have around, as more you need water, you know. So basically anyone can get in such situation. Anyone can get in such disaster, either endemic, either non-endemic, either caused by natural or non-natural disaster. But you can get in a situation, there will be an outbreak, you will have a deal with. So your life, your destiny, and life and health of your patients will depend on how you will act during such disasters. And here is the question: do we need to make lab investigation in order to decide which is the diagnosis and which is the treatment for cholera? No? Why?
We can see dehydration in the blood.
According to the symptoms, we can understand it is cholera, nothing else. So when should we do lab investigation? Before treatment or after treatment? In case of cholera, after treatment, because we don't have extra time. It is too precious for us. And if you will not treat the person on time, the person is dying in full consciousness. It's very important. But still, why do we make lab investigation for cholera? Resistance to what? So if we check it for resistance, that would mean we need to make investigation before treatment, not after. Right? Okay, very good. First reason to make statistic. For example, during pandemic, did you make a lab investigation like antigen test or PCR test or maybe sometimes antibody tests? But mostly PCR and antigen test, right? After lab investigation, did the lab investigation influence the treatment? No. It is treated just as a common flu, as any common cold, any common respiratory tract infection, right? Why did we do lab investigation of every single person with catarrhal symptoms? Why? To make statistics, to appreciate how many people have been infected with COVID, in order to appreciate how infectious is this new infection, new disease, right? How contagious is this? Okay, first for statistics. Second, for epidemiological reasons. Sometimes it is not enough just to prove the diagnosis, but it is also extremely important to prove the diagnosis, because there are some infections that could look like cholera. There are some escherichiosis that could look almost like cholera. So in order to differentiate, the treatment will be the same. Both of them are gram-negative, both of them are intestinal infections, both of them are treated with rehydration and antibiotically. And in the end, symptomatical treatment. So both will be treated in the same way. We don't need diagnosis to decide the treatment, to choose the treatment. But finally, there is nothing that gives you 100% diagnosis, 100% result of investigation, but lab investigation. So in order to make sure it is actually cholera, just to put in place of 99.99%, to put 100% cholera. So, for statistics, for diagnosis confirmation, and again? To report outbreak, okay. And which is the difference between sporadic cases and outbreak?
which is the difference between sporadic cases, like independent cases, and outbreak. Outbreak means it's something that spreads from human to human, from person to person, right? It is an outbreak. So it goes from person to person. Sporadic case, one person have been drinking contaminated water there. Another person have been drinking contaminated water in another place. They didn't infect each other. So these are sporadic cases. It is not an outbreak. So if we have 5 cases in the city, but all of them are situated on a big distance from each other, we have 5 sporadic cases. But if there is a family, for example, composed of 5 people, first have been infected father or mother, second another one, and after that children, and after that grandparents, and after that, and so on and so on. It is an outbreak. After that, colleagues, neighbors, and so on. It is an outbreak. But how can you make sure it is an outbreak? Serotyping. Because different serotypes and serovariants of the Vibrio cholera can cause this infection. So if all of them will have the same serovariant, and all of them are situated close to each other, we can talk about an outbreak. But if few of them will have different serovariants of cholera, it will show you we have a few sporadic cases. One more reason is, let's imagine we are in the place that is not endemic for cholera. But one day a person is coming to a hospital of infectious diseases near central building of our university, and the person has classical symptoms of cholera. We should check it out. Is it a local case or imported case? Okay? It is extremely important. Yes. The person could be in vacation or in a job trip in an endemic region and came back, and you calculate incubation period, you check if everything corresponds, you can report the case of import. But also here in this case also is important to make serotyping, because you check if this serotype or this serovariant is characteristic for that specific region he came from. So lab investigation will have a lot of purposes, not only for decision about treatment. And regarding treatment, whenever we are talking about treatment, as well as we already discussed, the first line treatment is rehydratation or liquid replacement. Liquids and electrolytes. Because with water, the person is losing electrolytes, salts. This is why it is extremely important to replace. And on previous lectures, we discussed about way of administration. How should we administrate liquids the patient lost? How? We can administrate liquids orally. We can administrate liquids intravenously. which way you will prefer? Orally or intravenous?
Intravenous.
Why?
Because he's toxin fluids from intestinal tract.
So?
So it's better to administrate in intravenous.
Again, why?
If we give it orally, it will lose faster.
Okay, if you give it orally, the patient will lose it faster. Makes sense. But huh? Both at the same time. Here's the question: can you do it at the same time all the time? Another question I already gave you last time: how you will replace the liquids faster, intravenously or orally? Or why orally is faster? In 1 minute you can potentially drink a liter of water. In order to introduce 1 liter of liquids intravenously, you not put it in jet, right? It is called perfusion or droplet introduction. So, can you drink droplet by droplet? No. You will drink good, especially if you are thirsty. So, orally will be faster. At the same time, it would be fair to say, okay, but intestinal tract lost its function of absorption. Yes? Or not? But not the entire intestinal tract. In some places where bacteria attached the enterocytes, that region will be affected, but you shouldn't think that entire intestinal tract is affected. So partially it will lose its function and partially it will keep its function. Moreover, with this drinking water, you will also help a little bit to wash it out. So on the first place we'll have oral rehydration. But there are some cases in which the person is not able to drink. For example, it could happen, not too much, if the person is extremely dehydrated, it can be unconscious. So in this case, of course, you don't have any other way except intravenous rehydration. But there is another reason the person will not be able to drink. It is one of symptoms we can have during cholera. The patient is losing liquids not all the time just by diarrhea, also by vomiting. So if the person is has vomiting again and again, it is almost impossible to make the person drink. In this case, of course, we'll have the only way to rehydrate the person by intravenous liquid replacement. But of course, the best way, just as you told, the best way is both. If the person is conscious, if the person doesn't have vomiting, just diarrhea, it is the best way for a person to apply double rehydration, oral and intravenous. But it is important to start it as fast as it's possible, because when the person lost too much liquids, it becomes very hard to find the vein. So how you will introduce it? Can you imagine the person has vomiting and is not able to drink? The person is almost unconscious because of liquid loss. The elasticity of the skin is extremely low. The the arterial pressure is very low because low volume of circulating liquids, and you're trying to find the vein. This is why the time is extremely precious. As faster you will start treatment, as better it will be for a patient. And what is good about cholera, you don't need to be a doctor or to have any medical degree to know that and to be able to apply the treatment. From the moment person started having diarrhea, a lot of liquids, drinking liquids. This action will decrease severity of infection, of any intestinal infection. As often as you have an intestinal infection, start with liquid replacement. It doesn't matter is it cholera or not. Start with liquid replacement. It will decrease chance of having serious complications, and it will increase the chance of comfortable treatment if you get to a doctor, if you get to a hospital. And as prevention, we already discussed it. It is extremely important to prevent cholera by infrastructure creation. It is up to the government. Personal hygiene habits, culture, hygienic culture. It is up to the entire society, but especially to doctors. It is up to you. Your own personal hygiene, so you must show an example. Drinking safe water is extremely important. Eating, consumption of safe products. While visiting endemic areas, having your own bottled water, having your own foods, and so on. Some people prefer extremal tourism, and they are visiting such poor regions, and they consume the street food, Sometimes it looks delicious and smells delicious, but did you see conditions in which it is prepared? And sometimes it even doesn't look delicious, but at all. But still, and is prepared in some awful conditions. And I guess a lot of you saw such videos on internet, like rats are running around. So having normal how it's called, like some instincts of self-protection, at least a little bit, in order to avoid some uncomfortable, let's say, situations. And two more infections, Campylobacter and Helicobacter, for your individual work. Okay, that's it for today. Wish you good luck.